A very good evening to our viewers. Welcome to the Evening Review. I'm your host, Matthias Aufiku. Well, it's been a long year and both the public and private sector had a very busy year. And of course, tonight we look at the public sector, the health sector, that's to be specific. Of course, we do know that within that sector, nurses are a cornerstone to the sector being efficient and also effective as far as public health service delivery is concerned. To recap the year within that sector, we have in studio tonight the General Secretary of the Namibia Nurses Union, Mr. Junias Shilunga. It's been a while since we've heard you on the Evening Review. Good evening and welcome back.
Yes, good evening, my brother. It has been a while.
Yes,
yes,
yeah. It's good that we have you during this time of the year where things are sort of cooling down.
Absolutely.
And I'm sure everyone is looking to get good rest and prepare for what 2025 is in store. Maybe just a recap of 2024 as far as the union's work advocating for the well-being of nurses is concerned. How has the year been?
Yeah, thank you very much for the opportunity to recap the year. As a union leader, it was not really an easy year for us because we had a lot to attend to, and the nurses issues remains critical to us, and we have been pushing here and there, and so we have been busy the whole year. So we are looking forward to the new year.
Yeah. When you say nurses issues, I'm sure the viewers would also be wondering, what are some of those pertinent issues that are always on your desk as far as the well-being of nurses is concerned?
You know, nurses are the backbone of the healthcare system in any country. So they have to be taken care of in order for them to be able to deliver quality healthcare to the patients and to the general public. So this year, our focus was more on educating the nurses on their rights and also their responsibilities, and also to listen to their cries. So what we have picked up during the course of the year, the challenges of shortage of nurses in the hospital, dilapidated infrastructures where they are working. Our nurses, they are not even provided with aircon, so you find them in those confined rooms screening the patients. Sometimes those rooms are not even having windows. So, and also the issues of overtime. In fact, there are many issues that are facing the nurses in our country. Yes.
Some people will be wondering, you mentioned shortage of nurses, but there's been so many cohorts, graduate cohorts in recent times being churned out from universities that offer nursing courses. Where is, how come we still have a shortage in that?
Yeah, no, we have seen a lot of nurses graduating, but the whole issue is the government is not absorbing them. They are staying at home with their skills, and that creates the shortage in our hospital, because we were hoping that now that we have a lot of nurses, we have a lot of training institutions, we expected not to have the shortage of nurses in our country. But that one remains a challenge in our healthcare system.
And of course, when these graduate nurses are sitting at home, those are potential members that your union is losing out on. So perhaps as a stakeholder, what are you and your team doing as far as perhaps consulting or engaging government is concerned? What are you guys doing in that regard to really just ensure that this matter is dealt with?
No, we engaged the government and we informed them that, look, our hospitals are there and now we have critical shortage of nurses in our country, in our hospitals. So it is up to the government to recruit.
Yeah.
We can't recruit.
Yeah.
As
So what is
a
their
nurses.
response? What is their response?
We engage the ED, in fact, the deputy ED of health. We have also wrote a letter to the minister. Yeah, but you know, sometimes you don't get the answer that you.
Yeah.
Yeah, but all we are hoping for is that the government must put Namibian people into confidence, and just to make sure that our people are not suffering in our hospitals to be in long queues because they are not nurses to attend to them.
Yeah.
Now that we have a lot of nurses that are being trained, it is to the advantage of the government to take that opportunity and absorb those people.
Yeah.
Yes.
You also mentioned the issue of dilapidated and old infrastructure. And we keep on hearing about this situation, especially within the public healthcare system. Can you maybe just paint us a picture of what it's like on the ground? What are your members telling you? How is this situation impacting their work?
Yeah, the situation on the ground is like this. We have hospitals which were built during apartheid. Up to now, our government did not build any single referral hospital after independence.
Yeah.
All those hospitals that you are seeing, we have inherited them from the apartheid government. So, and they are not maintained. They are still in that old age state. So what we are saying is the government must take care of the infrastructures and also try to expand because the population is also growing. And we are advising the government at least to expand. If they cannot build new ones, they must expand so that our people will get the health care that they deserve. It doesn't make economical sense to have people being referred from Katima to come to Windhoek. Imagine a person who is in pain being loaded in those big buses to come and seek healthcare in Windhoek. Why? Because we don't have the service that is needed in our regions. We don't have specialized service in our region.
Yeah.
So we rely on Windhoek. We refer our patients to Windhoek, which doesn't make economical sense because the person has to be loaded for 8 hours in those big buses in pain. And that is why we are saying, why can't, if they cannot build new hospitals, why can't they expand and also decentralize the service, which is in Windhoek, to the regions?
Yeah. So the issue of the region with Windhoek, what is the situation like? What are you getting from your members as far as working conditions are concerned between your members in the rural areas and those in the urban centers?
No, in fact, the conditions are different. If you come to Windhoek, the nurses in Windhoek, they are complaining that they are being overworked.
Okay.
If you go to the regions deep down there, they are telling you they don't even have equipments to conduct some procedures. Sometimes they don't even have medications the basic medications, basic antibiotics to assist the patients. So the conditions are different, and it's very concerning because every time you visit the patient, the nurses, they are complaining that they have been crying for those services, but nobody's listening to them. And that brings frustration to them. And also that delays the service that needs to be provided to the patient.
Yeah. Do you think this contributes to the frustrations that we always read about, especially on social media, where members of the public would say they would go to hospitals and nurses are not attending to them on time, or nurses are being rude and so on? Do you think the general working conditions under which nurses are compelled to work contributes to some of this, I wouldn't want to call it clashes between healthcare providers and members of the public who seek healthcare services? But what is your take on that?
Yeah, I cannot really say that contributes, because everyone has, when you are coming to, or when you are complaining, you have reasons to complain, and there must be something that prompted you to complain. But the fact of the matter is that the general public expected a lot from the nurses, especially in state. And the whole issue now is the general public, they only see the nurses. They don't know what is happening on the ground. They don't know that nurses are also being suffocated by the system. Nurses are trying by their level best, but sometimes there are limitations. And that, for me, I don't blame the general public. They have reasons to complain. In fact, they need to complain. It's their democratic right. And also, to complain is also to make sure that, because they are part of this, they are stakeholders in this healthcare system. So we need each other, and we need to shape this healthcare system together.
Yeah.
So for them, they must continue looking for if there is any fault, so that those faults can be addressed.
Yeah. Looking back at the 2024 and the preceding years, would you say there's improvement being made as far as the well-being of your constituency, which are the nurses, is concerned? Would you say there's progress being made? What is the union's take on this? Or are we regressing, or what is the state of affairs?
In fact, I think we are stagnant. Nurses were the people who were supposed to be looked after, even to get proper wages. Now we are even struggling. Our nurses are not even getting uniforms. And uniforms forms part of the protective clothing. So they have to take money from their pockets, and so that they buy their own uniform. That's why if you go to our hospitals, you find different uniforms. Sometimes we cannot even differentiate if this one is a cleaner or a nurse, because they are buying their own uniforms and they are making their own designs. The other issue is the security in our hospitals. We have been telling the government that hospitals need to be protected. We have cases whereby nurses are being threatened at work, sometimes attacked. So their lives is always at risk. But if you go to the hospitals, you just find these poorly trained securities who cannot even handle an aggressive patient or aggressive somebody who pose a risk to both nurses and the patients. So I can't really say we are progressing, because we expected the government to prioritize our nurses in the healthcare facilities.
Okay. Well, Mr. Shilunga, we head for a short commercial break, and we'll be back to continue this conversation. To our viewers, we head for a short break. Stay tuned.
Santa has a festive surprise for you. Starting 2nd December, unwrap the magic of Christmas with our Advent calendar. Spot the Christmas globes in your favorite newspapers from Monday to Friday. Scan the QR code or WhatsApp hashtag Advent Calendar 24 to the Synergy chatbot. Find the Christmas globes on NTV. Or visit our Facebook pages for daily Advent doors from Monday to Saturday. Win daily prizes. Lucky winners will be contacted and Logistics Hub Namibia will deliver your prize. Merry Christmas from Santa and his proud prize sponsors.
As the holiday season draws near, ShopRite and Synergy Chatbot are delivering the Christmas spirit. Welcome at Santa's Wishlist. Follow the instructions to submit your drawing and letter to Santa. Step 1. Start by drawing a picture for Santa. And when you're done, just jot down a few details about yourself right next to it. Step 2. Scan the QR code and it will open up WhatsApp with a little message that says hashtag ShopRiteSanta. Just send that message to Santa. Or if you like, you can also type hashtag ShopRiteSanta into WhatsApp and send it to the number as indicated. Step 3. Follow the simple steps in the chatbot and submit your name and age. And most excitingly, the present you've picked from the list. Don't forget to include your physical address so Santa can find his way to you. Step 4. Once you've completed the previous steps, snap a photo of your drawing and your letter to Santa to submit your entry.
Now, remember, I'm looking forward to all the wonderful drawings and letters you'll be sending my way. See you soon, and keep spreading that holiday cheer. Ho, ho, ho! ShopRite Namibia and Synergy Chatbot are delivering the Christmas spirit. This festive season, I've got a very special surprise just for you. My magical elves will be delivering gifts straight to your doorsteps. Grab your crayons or pencils and draw me a picture. Simply save the number on your phone and follow the on-screen prompts.
Welcome back from that break and thank you for staying tuned. Mr. Shilunga, we've touched base on the year that was. Just looking ahead, we've seen government having a groundbreaking ceremony in Katatura to build a new hospital. And of course, that would also alleviate the shortage you spoke of earlier on as far as employment opportunities for nurses is concerned. What is the union's aspirations going forward as far as addressing the challenges that you've mentioned during the first half of the show?
Yeah, thank you very much. Yes, we have seen groundbreaking, and we have been seeing groundbreakings of hospitals.
Yeah.
So all we are hoping is that this one will materialize. Yes, because the whole issue is the population of Namibia is growing. And our people are still, majority of our people, to say maybe 80-something%, they depend on public health. They seek healthcare, mostly in public facilities.
Yeah.
So all we are hoping is that this one will materialize, so that the unemployed will get a job, and also to alleviate the pressure and stress in those existing facilities. Also, we are also advising the government to look to the regions. it doesn't make sense, as I have been saying, that we still have patients being transferred from as far as Katima to come to Windhoek. We need referral hospitals in every region. There was a plan to build a referral hospital in Otjiwarongo, which we were hoping that it will alleviate so much pressure from Windhoek and also regions as far as patients' referral is concerned. But it's a white elephant there. They put a fence, but I don't know. They don't even mention it in their budget anymore. But all we are hoping is that the government will consider building and expanding the existing health facilities.
Yeah, but as far as keeping the government as far as holding them accountable is concerned, do you raise some of these issues during your engagement sessions? To say there were plans to set up a referral hospital in Otjiwarongo, Ondangwa. All these plans are now shelved. Are these some of the issues that you discussed during your engagements?
Yeah, we discuss all issues. We also raise those issues with the government. Yeah, so and it's the government that initiated those those projects. And if the government which initiated those projects cannot deliver, for us, we don't know what is in the coffer of the government, even though we hear that there is budget.
Yeah.
But sometimes those issues are not even raised in the budget.
Yeah.
So, but for us is to raise those issues, is to make sure that we engage the government properly and inform them that this is a crisis and it needs to be addressed.
Yeah.
That is our responsibility.
Yeah.
So we have to hold them accountable. Yes.
Okay. Also, the issue of there are thousands of graduate nurses who remain unemployed, but these health training centers continue to churn out more graduates. What is the best way to manage this situation going forward?
Yeah, the issue of mushrooming of training centers has been a concern. And last month, or in October, the Nursing Council released a statement and also advised the training centers to reduce their intakes. And also to not register new training centers. So, but we also have to be careful. If you have followed the history, I think around 2016, 2017 there, or 2014, we had a crisis in the country of shortage of nurses.
Yeah.
Because we were only having the University of Namibia and also the training centers of the government which were producing nurses. So we had a crisis and we have to go out and also to get some nurses from other countries like Kenya. We had some from Kenya. So we cannot really condemn the growth of the training institution in the country. All what we need to do is just to advise that they must get the nurses, the nursing student must get proper training.
Yeah.
Because if you look also when you have a mushrooming of training center, sometimes you have to think who is teaching these students. Are they being taught by qualified people? Do we even do
Are these centers not regulated and monitored?
You know, when there is too much of everything, it becomes a problem. And where do we get the skill of those people who are training the nurses?
Yeah.
So it's also because we must not really look at the quantity sometimes.
Yeah.
We must focus on the quality that is being produced. So we have to advise the government just to make sure. And I think the Nursing Council now is very serious. Yeah, because we even sent, I think we have more than 10 inspectors from our unions that are also inspecting those institutions.
Okay.
Yeah, so we want things to be done properly, and we want quality.
Yeah.
We don't just want a lot of nurses who are not well skilled. Yes.
So what is some of the feedback that you are getting from your inspectors in the field? What are some of the issues that they are picking up there?
Yeah, so our inspectors, they just started because I think there were some issues, but they just started, and I think with the new regulations that the Health Professional Council is putting in place, we have confidence that things are going to be well, and we hope that even though we are regulating the intakes and also the growth and the mushrooming of the training centers, we still want quality from those existing ones.
Yeah.
And that is why we are appealing also to NQA to be serious and investigate and also inspect most of those training centers together with the Health Professional Council of Namibia.
I know you mentioned the issue of the mushrooming of some of these centers, but how did we go from a critical shortage of nurses in 2016, and even going to an extent of importing nurses, to now the market being flooded? Surely it can't just be because of the mushrooming of institutions.
Yeah, so the whole issue is, when you look, as I have mentioned before, that all the health facilities that we have inherited them from the apartheid government. So that's why I'm saying I'm not condemning the growth of training institutions.
Yeah.
In fact, we need more so that we can even import our skill to other countries. But the government, we are still stuck. They are not building new hospitals. They are not building new clinics. We are still relying on those old infrastructures. They are not even expanding. Yeah. So, and as I have mentioned that the population is growing, our hospitals need more nurses. And those nurses, we have them now, and they are seated at home.
Yeah.
So it's up to the government to absorb those nurses. It's up to the government to build more new hospitals, new clinics, new health centers, so that our people cannot walk long distances to access basic healthcare.
Yeah.
So that's we are happy to see that our country now, even if it is now saturated, because the supply and demand is not corresponding, but it's something that we are happy to see.
Yeah.
And if our nurses are well trained, we cannot just claim that they must be seated at home. They must also look for opportunities outside the country.
Okay.
And also our ambassadors, they must also get those opportunities in the other countries.
Yeah.
Just like other countries, I'm always giving an example of Kenya, because Kenya, the ambassadors are always trying to look for opportunities for their people in other countries. And that is what we expected also from our government.
Yeah.
Because if my dream is to become a nurse, I cannot be stopped because the industry is saturated.
Yeah.
I must attain my dream. And so it must not be something to say, no, because the industry is saturated, you guys cannot train nurses. The nurses must also penetrate in other countries.
Yeah.
And also the government's responsibility to build and recruit, expand the health facilities, let's absorb our nurses. They are well skilled. Let's not allow them to be wandering with their skill in the streets.
Well, Mr. Shilunga, thank you very much for your time this evening. Hopefully you'll get a good rest over the festive season and come back rejuvenated during the new year to continue the good work you and your team are doing for the well-being of the nurses of Namibia.
Thank you very much, my brother.
Thank you very much and have a blessed festive period.
Thank you very much.
Thank you very much. Well, to our viewers, that's it from the Evening Review team. Thank you for staying tuned and have a pleasant evening.